summary statements about about that percentage of preschool children who improved. So if we go to the next slide. So for all three of those areas, there are 5, I believe, if I remember correctly, as I go through this. I think that there are 5 different progress categories. So there's 5 different ways that preschool children can progress in those areas. The first progress category is progress category A, children who didn't improve their functioning. So these are the children that, you know, when they came into the system at 3 or 4 or whenever they're identified, when they leave to enter kindergarten, they showed no improvement in that area of, you know, social, emotional, or knowledge and skills or behavior. So this is the category where you want to have the lowest number of children, because those are the ones, you know, that it looks like, you know, we're not helped by the services. Let's go to the next category. So category B is those who improve their functioning, but not enough to close that gap. So when it says not sufficient to move nearer to functioning comparable to same age peers, that's just the gap didn't close at all. So they improved, but they didn't improve as quickly as their same age peers. So the gap might have gotten bigger, or maybe they improved at the exact same rate, so the gap just didn't close. Next category. Progress category C is they improved functioning to a level nearer to their same age peers, but they didn't reach it. So they're closing that gap, and just not, there wasn't enough time, or there wasn't enough of you know, a high enough rate of improvement to close that gap from where they started. So maybe if we went until they were age 6 or 7, the gap would have closed, but in this case, they got close, but they didn't get all the way to the same level. And then let's go to the D. So progress category D is that they closed that gap. You know, they started out behind their same age peers, and then over time, receiving the services, they improved to a level that's comparable. So now they're, you know, right on the same trajectory. They've closed that gap. So that's a really, that's like the best outcome in terms of progress. Let's go to E. And this is those who maintain functioning at a level comparable to same age peers. So these are kids that maybe their knowledge and skills when they started, there was no gap, right? Knowledge and skills might not be the reason why they were identified for services and became eligible. Maybe it's behavior, right? Like behavior might have been the area. So in knowledge and skills, they might have started out at the same level as their same age peers. And in progress category E, they just stayed at the same level as their peers. So they progressed at the same level. So they didn't get you know, they didn't regress. They didn't have a gap appear. They started with no gap and they ended with no gap. So that's a great category too. So now let's go to the summary statements. So summary statement 1 is of the preschool children who entered below age expectation. So of the children who entered in either category, they could end up in A, B, C, or D, right? So there was a gap of some kind in that outcome. The percent who substantially increased their rate of growth by the time they turned 6 years of age or exited the program. So we're looking at progress category C, which is they improved, but they didn't close the gap completely. And progress category D, they closed the gap divided by all of the other children in A, B, C, or D. So this is a summary statement that looks at only the kids that started with a gap in that area. Next slide. Summary statement 2. So this looks at it a little differently in terms of the outcome. This is those who were functioning within age expectations in each outcome by the time they turned 6 or exited the program. And so this is looking at D and E, right? The ones that closed the gap completely, or the ones that started with no gap and ended up with no gap, divided by all of the children who were evaluated. All right, so this is the first summary statement is let's look at all that improvement, and the second summary statement is let's look at all the kids who ended at the same level as their non-disabled peers. So that's what OSEP is wanting. That's what they're looking at. And let's go to the next. So a state could sample children for assessment as long as the description of the sampling methodology is submitted. I don't know of any states that sample. I think most states have just said, we're going to test all of our, we're going to evaluate all the kids' outcomes. Only children who receive special ed and related services for at least 6 months during the age span of 3 through 5 should be included. So if you have children who are identified, at 4.5, or 5, and so they don't, well, I guess if it goes till 6, 5.5, all right, they're not going to count. Or if you have kids that start at 3 and then they, for some reason, are not eligible any longer, or maybe they move out of the system, and so they don't receive 6 months of services, those children are not counted in the calculation. So really, you're only being held accountable in this indicator for kids who were at least 6 months during that period. And then the state also has to report the instruments and procedures that they use to gather the data for this indicator. So not only are states reporting child level outcomes in those 5 categories for the 2 summary statements, but they're also then reporting only on kids with 6 months of service and what they use to measure it, because every state can choose something different. And now I think I will kick it over to Andrea if she's on. I'll kick it over to Andrea and she'll talk to you about indicator 7, preschool outcomes, and then kind of the programming, the ways that, you all in Kentucky hopefully are getting your children there.
All right, thanks, Steve. So this first is a link to our state performance plan and annual performance report. You'll hear us mention that as the SPP-APR. We do like our letters in special education. This guide has a lot of support and documents and guidance in there. So if you were unfamiliar with the SPP-APR, please check this out. This is a great resource for districts to have. Next slide, please. All right, so as Steve was saying, indicator 7 is preschool outcomes. So in Kentucky, we now use the child outcomes summary. This is a little different. The last 3 years, we've been working our way towards the COS and getting all this data into Infinite Campus. We decided to make a change from the old system. Some of you may or may not be familiar with the KEDS system, the Kentucky Early Childhood Data System. We use that for a very long time in Kentucky. We were one of, I think, 3 states, territories at the time to not use the child outcome summary. So in an effort to gather better data on our preschool programs and our preschool kiddos, on how they were going throughout the program, making progress, we decided to change to the child outcome summary. We joined most of the nation and territories with that. Like I said, 3 years ago, we decided to do that. And that helps us to gather data more efficiently, to report those outcomes to OSEP, the Office of Special Education Programs. We also use this information on our students without disabilities. You're also required to collect that on students without disabilities. So we are starting to look at that data to see how our inclusive preschool programs are working towards the better goals for our kids. Next slide. The COS uses a 7-point scale. So if you do remember the KED system, if you were around for that, or if you were teaching then, or maybe you were in a school district that used a certain assessment for their preschool program, we would use just that one assessment, that one date, that one assessment scale to provide their outcome data. Now we use a 7-point scale twice a child's career. So they have to have an entry and they have to have an exit. We do ask that districts put that information in. Most of our districts do it 3 times a year, kind of fall, winter, spring, just so they can kind of get a feel for how the kids are progressing through the program. So the team, and then we'll talk about the team here in just a minute, they have to assign that rating from 1 to 7. They use anything they can for that assessment progress. They have to use an assessment for the classroom. They have to use parent input, provider input. They have related service providers for that child. or anybody else who may have an interest in that child's functioning. We have some districts that it's just the teacher and the parent, maybe an assistant teacher and related service providers. We have others that really bring in the whole team that surrounds that child. They have the teacher, the assistant, the parent. They may have a bus driver or a lunch monitor, someone who's really involved in that child's transitions, thinking about that child in a holistic manner on how they are progressing through the system. They look at those ratings, they compare them to age expectations, and they pick those different numbers at 1 through 7. Then we can look at that and see how they've progressed over time. Next slide, please. As I was saying, the COS process uses multiple methods and multiple sources of information. This really is a synthesis of information. The COS is not an assessment. It is not a one-time kind of snapshot on that assessment day of the child's progress. It really goes across the spectrum of that kid's enrollment. You must use an assessment tool. That is one thing that is required. And the parent must have input in this process, and the teacher, of course. But other than that, it's up to districts to pull information in on what they want to use. A lot will use observations. In preschool, we have anecdotal reporting that happens a lot. So you go throughout the day and you can, while a child is learning in the block center, you can sit down with them and see all kinds of developmental skills and use that as an observation and anecdotal notes to come back and really put this information together to see how that child is progressing through the preschool program. Like I said earlier, the multiple sources of information, there's just some examples on that list there that school districts will use to make that team. We have provided guidance and have some links to some resources here at the end of this slide deck. We've got some forms that you can use, or child, gathering data on the child forms that you can send home to the parent. Parent can come in and have a conference. Those are just, things that we provide that you can use. You're not required to use those, but they're really good information that can help you kind of put this information into one spot. So it's easier to gather for the school districts. Next slide, please. So once you have all that information collected, you will put that information into Infinite Campus. Now, Infinite Campus can be wonderful, and Infinite Campus can be the bane of our existence sometimes, but we really enjoy having all of our data in one place that we have access to, that we have, places where we can go and look and can help and support school districts on a more personal level on getting this information in to the system. It's under the Custom Forms tab. You do have to have rights assigned from your local districts to have that Custom Form tab. If you do not have that access, you have to go through your Infinite Campus person in your district. That is one thing I cannot do. I'm an Infinite Campus. I cannot provide that access for you. I can help you find your IC clerk, but that's about all I can do for that. But it's really a great place to have all of our kids' information at once, in one, one-stop shop. That's why we do love Infinite Campus. Next slide, please. As I said earlier, the only things that are required is an entry and an exit. So if that child comes to you as a 3-year-old, that's their entry, and they don't exit until they turn 4 and go to kindergarten. So they may have 2 years of data. So, but we really encourage and we really provide support for our districts to do interim ratings. That would be fall, winter, spring. That would have these different timelines on them, making sure that we really are collecting a broad picture of how the child is performing throughout the preschool program, not just a 1 and a 2. The first entry points are due December 1st, and the last exit entry points are due May 31st. There are some other dates within there that can help districts kind of put a path on that. A lot of our districts are used to doing that because with the old assessment system, they had to do a fall, winter, spring. And so this is kind of easy for our districts to understand. But that December 1st and May 31st date is how we collect the actual data that we send to OSEP for Indicator 7. Next slide, please. These are some resources. The ECTA Center, that's the Early Childhood Technical Assistance Center. That's one of our OSEP centers. These are 2 really great references. That reference guide has a lot of great information on how to provide the ratings, how to go through the ratings with an age expectation They have some quizzes, and I know Daisy Center, I didn't link Daisy Center, I probably should have. They have some other things as well on there. The Daisy Center is the Early Childhood Data Systems, OSEP TA Center. They have some great kind of reliability almost for the COS process. They have some quizzes that your teachers can take, and they can learn how to best rate kids, thinking about, thank you, Steve, for putting that in the chat. They have some great resources on that for your teachers to help them understand the process, help them to think truly about where that child is. If it's a 1, if they're just not there yet, they just can't do that skill yet, versus being a 3 where it's starting to evolve. And then the national highlights for Part C and Part B, that just kind of shows the outcomes for kids across the country, the states and territories that provide special education services for preschoolers. That kind of is just I'm always interested in national data. I'm always interested to see where Kentucky kind of falls in these spectrums. That can just give you some good data to look at it on your spare time. If you are a data nerd like me, you can go through that. And then the KDE Early Learning Unit, we have some guidance on COS. We have a guidance document. We've got some sample forms, as I said earlier, and just some different things that might be useful to you if you're learning about this process for the first time today, or if you're already supporting students and teachers with this process. Next slide, please. Okay, so that's all COS. Are there any questions about the COS process? Any questions about indicator 7? We do collect the data on children with disabilities and children without disabilities, which is a little unique. Not a lot of 619 programs do that. Special education preschool programs don't really do that across the states and territories. We really are interested in both sets of data because the COS is a good system to look at kids holistically. And so it really makes sense to get all of the data that we can on our kids. And then you're able to have that as a school district at your fingertips as well. So you can take that to your board, to your superintendent, to people that you may help you make decisions about the preschool program, and show them this is our outcomes. These are where our kids are growing. Here's where maybe we need a little bit more support. It can be a really good system for that as well. Any questions about that before we move on to preschool regulation?
Andrea, this is Alicia, and I just wanted to add that you kind of touched on that. Using the entry and exit COS data is a great way to sit down with your preschool teachers and really celebrate what they do in the lives of kids, like where they start on day 1 and where they leave the program. There's so much growth that happens. And so using that data is a really great way to celebrate what they're accomplishing in their time with their students. So just thought I'd add that.
Yeah, sure. And I'll delve a little bit into, my past life as a preschool teacher. We collect so much data, just copious amounts of data on these kiddos. And when we were using just one assessment, sometimes I didn't feel like that assessment was capturing what my child in my classroom could actually do. I didn't always feel like I was able to show the true picture of them. Even though I had mountains of data, everything kind of came down to that one score on that assessment. So this process, I feel, really brings all of that data together so that our teachers are able to truly show the progress of our preschool students across the program. And it's always great to highlight, what good things are happening in early childhood. Okay. So if there's no questions about that process, and if you do have questions, please feel free to email me, give me a call, let me help you out and support you any way that I can. We'll move on to preschool regulation. So preschool regulation is 704 KAR 3:4110. That is like embedded in my brain these days. This is the regulation where preschool program services are defined. Now when you read this regulation, please keep in mind it was written in 1990, which was a little bit of time ago. We won't talk about where we all were in 1990, but it's a little bit dated. So there's some terms in here. There's some dates in here that have been changed by a statute update. There are some things that are kind of vague a little bit, but that is something that we are aware of and we know. But this is how you would go through if you're setting up a program for the first time, or if this is your first time thinking about preschool programming. This is a great place to start because it lines out exactly what you have to do, who's eligible, what you have to do for your kiddos and your parents, and what's required for your teachers as well. I believe that QR code takes you to the regulation. Next slide, please. So this kind of just breaks down the different sections. So if you're looking for something specific, if you're looking for attendance, attendance is a big deal right now. Attendance is non-compulsory in early childhood programs and preschool programs in Kentucky. However, we do have some requirements. If a child is not shown up and you haven't heard from the family, you have to contact them within a certain number of days. It talks about when you should do that, how you should do that. Also talking about program operations, Kentucky preschool programs are only required to serve students 2.5 hours a day for 4 or 5 days a week. Most programs go well above and beyond that. That's the program operations section. And then professional development, we do have a regulation about what's required. We require the same state-funded preschool teachers that are certified, they are required to do the 24 hours of professional development, just like every other teacher. However, we want those hours to be focused on early childhood, not learning about algebra doesn't necessarily help a preschool teacher. So keeping that in mind when you're designing the professional development. Next section, please. This one is about environment. This is really where it delves into the actual kind of what your program should kind of look like. You'll see developmentally appropriate practices. We talk about DAP a lot because kiddos that are 3, 4, and turning 5 need certain things to have access to learning. They need to have centers. They need to have routines. They need to have open play, free play. They need to have a balance of quiet play, of loud play, outside, indoor, to really focus on what is developmentally appropriate for that preschool child. It also goes into individual needs of children. That's where we kind of hit on special education. Our regulation requires that you serve children that have disability, but you also are serving them and providing for them spaces for their individual needs, making sure that you are tweaking your ratio, which is 1 to 10, 1 adult to 10 children at all times. Maybe you have to tweak that. Maybe, you have a cap of 20 kids in your classroom, which is a hard cap, only 20 kids. Maybe you need to have 17 kids in that classroom because you have students with some more severe disability. That's regulation, part of the regulation speaks to that. It speaks to changing your ratios as needed to meet the needs of the children in your program. Talks about equipment and materials, making sure things are in good repair, making sure you have good materials. You have lots of things for our kids to learn with. We talk a lot about play in preschool. Play is learning. And so if your kids don't have items to learn with, it can make it hard to meet those outcomes. Next slide, please. The next kind of block section would be curriculum and assessment. You have to have a curriculum for your preschool program. It needs to be a curriculum that the district has chosen. We do not have a specific curriculum that we use in Kentucky. A lot of folks use things like Creative Curriculum. Frog Street Press is another big one that's out there. There are lots of new ones on the market, but making sure that curriculum is a solid early childhood curriculum. There's a Houghton Mifflin one, or Big Day, I think is the name of it. And making sure that you have a curriculum that is appropriate for your preschool program, and making sure that the children are able to access that curriculum. It's not too high, it's not too low, it's right where everyone needs to be when they're learning. This talks about the assessment of the children as well, which goes back to indicator 7. You have to use an assessment, assessment for your classroom, make sure that children are progressing. There's also evaluations of the program that have to be done. Parents need to have some input on the program. Staff, including not just teachers, but assistants, bus drivers, cafeteria workers, front office staff, anyone who's involved needs to have a say in that program. And this also talks a little bit about student information and screening. Screening is required for all of our preschool students when they come into the program. This kind of outlines the rules and regulations over those things. Next slide, please. Health, safety, and nutrition. Transportation, that's a big deal. Transportation kind of rules the world in school districts, but you have to have appropriate transportation for your preschoolers, which includes an aide on the bus, and you have to have transportation policies that kind of go into the safety policies, where you're only you're releasing students to people who are on an approved list, hand to hand, and students are not allowed to walk across the street by themselves. Adults have to be present to make sure that children are safe when we're leaving them off the bus. And the last thing anybody wants is a 3-year-old running around by themselves. So we need to make sure those safety policies are up to date. For the meal sections, programs are required to serve one meal, be that breakfast or lunch, depending on when or how long your schedule is. Like I said, a lot of our programs are full day programs now. So they'll do a breakfast and a lunch. Snack is not included in our regulation, as the regulation is only for 2.5 hours. So that is something that a school district would need to determine on their own if they were to provide snacks. Next slide, please. And then families and communities. So lots of family involvement in early childhood. Obviously, these are 3, 4s, and turning 5s in our preschool programs. Those are little guys, right? Those are itty bitties that families are just now releasing to you. It could be the very first time they have an encounter with the public school system. They may not have had a great experience in public school. So they're giving you their most precious resource. So we want to make sure that family is involved as much as possible. Volunteering. Now, I will say that COVID kind of wiped out some of these activities. We're seeing all of them come back, which is great. Volunteering, family nights, making sure that parents have input in the program. That's really important. Making sure that parents have access to social services as well. The preschool programs across our state are very good about those wraparound services being of the social service variety, having access to food banks, to clothing banks, to support with bills, things of that nature, even in higher education or getting their GEDs. Our programs are really well equipped to support our families in that manner. The wraparound services that are spoken to in this section would be childcare services. A lot of our districts, I'd say a lot, I'd say probably about half of our districts will provide some type of after school care or child care after the preschool program is over. Having those wraparound services in the program, making sure that these are appropriate for our preschool kiddos. And then here's the recruitment. We'll speak just a moment on the recruitment. Preschool programs recruit all year round. We have an open door policy. So kids that come to you this time of year in January, February, if they are eligible, they must have a seat. They must have a place to go, especially our students who come to us with a suspected disability. 3s and 4s, turning 5s in preschool. There is not a cap of number of the students that can be in the program. There is a cap for classrooms, 20 kids only in one classroom. But if a kid shows up on your doorstep and they're eligible, then they have to be served. Next slide, please. All right, so that was like 30 seconds of preschool regulation when I probably could have talked for 2 hours about that. So are there things, questions, concerns, things that just you don't understand, you need some clarification on before I turn it over to Jennifer Hagan to talk about our All Stars program? All right. So you all know how to get a hold of me if you need me. I see a lot of familiar names and faces on the call. So I'm here to help and support, as is the School Readiness Branch and the Early Learning Unit. So if you need support or help from us, please just reach out.
All right, so I'm going to kind of do a really high-level overview of our Kentucky All-Stars program. Hopefully, you all have heard about this new rollout that we have just launched starting the school year. But if not, hopefully this just gives you a general overview of that. And then if you need more information, feel free to reach out to us. Like Andrea said, myself or Andrea, we can connect you to the right people. Definitely the support of your RTCs are very important for this, for the All-Stars the whole thing, whether it's your cohort year or whether you're getting ready for your cohort year, they are going to be the people who are really going to offer you the best support. So definitely, I encourage you to reach out to them. So I'm just going to give, like I said, a real high level overview. This kind of really ties in nicely to what Andrea just shared, because all of the stuff that she just talked about in the regulation is what they look at for the All-Stars rating. So it's all of that kind of lumped into one, and that's where we look at the quality of our preschool programs. So this is the regulation and the reason that we do All-Stars. So I'm not going to read that to you, but I just wanted to share that with you. We can go to the next slide. I do want to share really quickly that this is for our Kentucky state-funded preschools. So if you do have blended programs or Head Start in your buildings, then just know this criteria is for our state-funded preschools only, the things that I'm sharing about today. So just wanted to say that really quickly before I kind of go into more detail. So like I did say, All-Stars has been around for a really long time, but we have made some slight changes to some of the requirements are still the same, but those components within those requirements have slightly changed. And so we are in a cohort rollout. And so we are in cohort 1 currently. So if you aren't sure what cohort your district is in, definitely get with either your preschool coordinator, they should know, or like I said, RTC, or you can reach out to us. So right now, everything seems to be going really well in our first cohort. So that's been really good for us. We've been able to get feedback, and so that's been really positive. And so we're hoping that it just continues to get easier and easier as everybody learns kind of the ins and outs. So this is just a really quick visual for you all to kind of see that their All-Stars is different levels. And so you coming in our state-funded preschool, you would come in at a 3 level based on what the requirements are within the regs. They automatically should be coming in at a level 3 star, but you can also do things that could get you to level 4 or level 5. And so it really is up to the individual program and the individual site, because the star level is based on site, not district as a whole. So really quickly, just kind of explain that a little bit more is, so if you have a district that has, one big preschool building, that is your one site. And if that's where everybody's housed, then you only have one site in your district. If you have a district that has, 2 classrooms at this elementary school, 2 classrooms, those are individual sites, and your star level is based on those individual sites, not the district as a whole. So hopefully that made sense to you all, but it is based on individual sites. But this is just a really quick visual to kind of show you what each of those requirements are for the level 3, level 4, and level 5. And on the next few slides, I'm going to break that down more for you guys. All right, so as part of All-Stars, there are points that you have to get, and then there are also requirements. So the point requirements that you have are based under these 4 domains. So family and community engagement, staff qualification, classroom instructional quality, administrative and leadership practices. So as you'll see, you see several things that Andrea just spoke about. You can see the connections there within those domains. So next slide, I'm going to break those down for you all. So like I said, you do have to get a certain number of points, whether you want to be a level 3 star program, level 4, or level 5. And so these are each of the domains that you can pull points from. So you do not have to get all of the points from each of the domains. You just have to go based on, like I said, which level you want to get. And here in just a minute on one of our next slides, you will see that broken down a little bit easier. But like, for example, this is family and community engagement. Here are all the ways that you can pull points from this domain. And so like the first one, program and site administrator and 75% of the staff complete professional learning activities related to strengthening family engagement. So that would get you 2 points. And for all of the things that you are going to use as your points, you do have to, during your cohort year, you do have to have a way to, upload evidence of that. So like 2 points for two-way communication with families. That one's a pretty easy one to get because most, if not all, of our preschools are using some kind of two-way communication, whether that be Remind or Seesaw or whatever you're using. And that would be pretty easy way for you all to have evidence to show. So I do want to share that during your cohort year, you will have to provide evidence of the points that you are using from each domain. Next slide, please. So on this one, you'll see it looks slightly different. One, there are a lot more ways to get points here for classroom and instructional quality. But something I wanted to point out is you will see that within this one, while you do have to get your point values here, there are also some required components that you have to meet. So one of the requirements is that 50% of the teaching staff have professional learning activities and developmental screening. The next one is that they complete an environmental self-assessment using a valid and reliable tool appropriate for the ages and settings of the children. And if you're not sure what is something that you could use as evidence for that, like I said, reach out to your RTCs. They have a list of things that they could give you on options for self-assessment. You just have to make sure that it is appropriate for the ages and settings of the students that you serve. And then the other one is participate in an environmental observation on an valid and reliable tool. And I will talk about that. And that's part of our changes that we have made. So I'll talk about that here in just a minute. So just note those things under each of those domains. Some do have requirements under those, but you also still have to get your points within that. So as you see in this one, there's a lot more ways to get your points here, but you do have to meet those requirements too. Next slide. All right, so this is staff qualifications and professional development. You'll see there are 2 required components here. So those are required, and then there are ways to get your points that are required for this domain also. And I won't read all of these to you all. We would be here all day if I did. So next slide, please. And then this is administrative and leadership practices. Here are the ways, and do notice that different pieces do have different point values. So pay close attention to that as you are looking to see like where you would be when in terms of point values for 3, 4, or 5 stars. Some of those are different point values. Next slide, please. Okay, so after going through that really quickly, I wanted to get to these next 3 slides because they, I feel like, lay it out in much more simpler terms here. So it's a visual that you all can kind of see what I'm talking about when it comes to your points versus the other requirements that go along with it. So you'll see on the left side, for a level 3 star, you have to get between 21 and 30 total points. Within that, though, you have to get a minimum amount of points from each of those domains we just went over. So your total points have to be 21 to 30, but you have to get 2 points from family and community engagement, 8 points from classroom and instructional quality, 2 points from staff qualifications and professional development, 2 points from administrative and leadership practice, and then at least 7 points, and you can pick and choose that from any of those 4 domains. So I know that's a lot, that's a lot of information and a lot of math, but I think this helps to lay that out much more easily for you all to kind of see there's a total points, but then it does break down how many you have to get from each of those domains. So then for a level 3, the requirements for that piece would be, if you've not heard of the quality supplement within GMAP, there is a piece that is within GMAP that is a quality supplement. So that has to be done. And that is where you will upload that evidence that I spoke about earlier. And then there also is a basic care checklist that has to be completed. And then the observation that I spoke about earlier as a requirement, that it has changed, and that is now we are using the Teaching Pyramid Observation Tool, or as we call it, the TPOT observation. And so during your cohort year, the basic care checklist and the TPOT has to be done on 1/3 of the classrooms at each of your sites. Okay, so if you have a building that has only one classroom, then that one classroom is the one that's going to have the observation. If you have a building that has 10 classrooms, then 1/3 of those would have to have that TPOT observation, and those are randomly chosen, and we do give that information to the districts during their cohort year. Those classrooms also have to have that basic care checklist done. If you don't have a copy of that and you would like to see that, you can get that from your RTC, and that is uploaded into GMAP, that basic care checklist on those classrooms. So we do have some required trainings that go along with all of these pieces, and the trainings are what help to get you ready to be successful for that TPOT observation. And so there is a quality process training that we did at the beginning of the year, and the RTCs have offered, and that is for our preschool coordinators, or they could choose a designee to send to that training. And then the introduction to the pyramid model, which is where the TPOT comes from, is the pyramid model. And hopefully all of y'all have heard lots of information on the pyramid model. So that is the requirement. The training requirement for pyramid model for a level 3 is just that introduction to the pyramid model, and that has to be done through your regional training center. And so the people that have to be trained are your preschool coordinator or their designee, and then all of your teaching staff. And then if you have an internal pyramid coach, they would have to be trained. And then we also obviously encourage your support staff to be trained in the pyramid model, just because we know that would lead to the most success in the classroom. Then TPOT reliability. So here's where I quickly want to share. I'm sure many of you, especially if you have districts that are in cohort 1 or 2, have had your preschool coordinators or their designee asked to go to TPOT reliability training. And that is so that they are able to complete those observations of the 1/3 classrooms, of those classrooms. And so we have offered several of those trainings. We will be offering more in the future. But if you have someone in district that will be completing those TPOT observations, they do have to go through that TPOT reliability training. So that is what that's for. So that is for our observers only. Okay, so we'll go to the next slide and I'll share what STAR level 4 looks like. So here you'll see the point values is increased. So you would get between 31 and 40 points. The minimums are still the same, and then you just have to get the 17 points of your choice from any domain to get that level 4. And then the required standards for that for a level 4 would be that GMAP quality supplement, the basic care checklist for that 1/3 of those classrooms, your TPOT observation. The difference here is that whereas for a level 3, you just have to complete that observation. For a level 4, now the score comes into play. And so your TPOT observation would have to be a 70% fidelity with no more than 1 red flag. And we don't really have time to go really deep into what red flags are, but that is a part of the TPOT observation. And so if you would like more information on what that is and what that looks like, please reach out to us and we can give you some more information on the TPOT observation tool and what that looks like. Then we've also have a required standard for pyramid implementation. And so that requirement would be developing a leadership team, and that will look differently depending on your district, because we know across Kentucky, districts are all different shapes and sizes. And so that leadership team would look different depending on your district. So that is where you'd want to reach out to those RTCs for them to offer you support on what your leadership team would look like to be most effective in your district. Then the required trainings, that quality process training I mentioned, introduction to the pyramid model, and then pyramid modules 1 and 2 are the additions on for level 4. And that would be for your preschool coordinator or their designee, all of your teachers, and then if you had an internal coach. And then we obviously encourage support staff, and the RTCs have shared that they often have room for you all to invite your support staff to be trained. And the RTC does offer all of this training. And then, of course, TPOT reliability for anyone who you want from your district to be an observer. Okay, next slide, please. And then here is our level 5. You'll see the point value has gone up again. So you would have to get between 41 and 50 points. Your minimum points from each domain stays the same. And then you would get 27 points of your choice from any of those 4 domains to meet that requirement. And then over on the required standard side, the TPOT observation score goes up to 80% fidelity and no red flags. And like I said, if you'd like more information on that tool, you can reach out to us. We also have linked some resources that would give you some more information on that. Then the pyramid implementation piece would be that leadership team that is required for level 4, but also as a part of pyramid implementation, action planning, coaching, and benchmarks of quality. All of those things, like I said, if you're not already a part of the pyramid work, reach out to your RTCs and they can give you more information on that. Then the required trainings would be your quality process training, the introduction to the pyramid module, and then for level 5, it would be pyramid modules 1 through 4. And like I said, those are offered by your RTC. And then, of course, TPOT reliability for our observers. Okay. Next slide. I'm not sure what's on the next one. Okay, so any questions? I know that was very, very high level overview, but I know we've got a lot to cover today, so I went quickly. But as I said before, if you ever have any questions, reach out to myself or Andrea, and especially use your RTC for support during this process if you're in cohort 1, especially because you're going through it right now.
Couple of questions in the chat. One of the questions is, when will they find out which classrooms are chosen within each of their sites?
Okay, if you are in cohort 1, those will be coming out soon. If you are in cohort 2 or 3, you will not find out until your cohort year, obviously, because classrooms change. Actually, I had an email today about some classroom changes. So it changes so much that we wait until kind of everybody gets settled into the new school year and new classrooms are added and those kinds of things. But for cohort 1, those will be coming out soon. So be on the lookout for that if you're in cohort 1.
Okay, and then another question, and Krista, I see you've typed one of your 2 questions. So clarification on the ratings. Are those ratings by individual or district? And does she understand correctly that schools could be rated differently?
Okay, so school districts are not, it's not their rating, it's each individual school. So we call it a site so that it doesn't get confusing. So each site would have an individual rating. So if you are a district that has 5 sites, you're going to have 5 different ratings. And so the things that the requirements that you have to meet would be based on that site alone, if that makes sense. So if we're looking at scores, we're going to be looking at only that site. If we're looking at who's been trained, we're going to be looking at only who's at that site. Hopefully that helps you out there.
She's not. And Krista, did you have a second question?
I did. I think it got on down.
It's in the-
Would
it's
it
in the
be
chat.
would it be a true statement that in order to achieve a level 5 stars, that we would probably need to work with a pyramid coach through our RTC? That would be likely one of the only ways for that to happen?
To work with their pyramid coach, is that what you're saying?
Hmm.
Yes. Yes. So you would need the support of the RTCs for that. Yes.
Actually, I think, I don't know
And
if
they,
that's the right question. Let me think about how to word that question. And I may email you, Jennifer, because
okay.
yeah, let me think about it. I don't think I asked that correctly. And so I think
Okay.
I
Okay. Yeah. Email me. Okay.
All right. So that was a lot to start with indicator 7 and go all the way through the quality rating process. But the reason for that is so you see how the importance of designing high quality, inclusive preschool programs, so that our children receive the best possible start that they can and have those great outcomes, not only exiting preschool, but that carry them forward. And so we wanted to kind of bring you the full package for those of you who this is preschool's new to you. This is not a world that you're super familiar with, because it's all very spelled out in the regulations and through our quality rating. But it takes a minute to digest if you're new to this world. So just kind of take it all in and see how it all connects. And now moving on to indicator 12. So back to you, Steve.
All right, thank you. That was a lot of great information. If you go to the next slide. So now we're going to talk about early childhood transition. So this is an indicator that looks at the percentage of children referred by the Part C program prior to age 3, found eligible for Part B, and have an IEP developed and implemented by their 3rd birthday. So what we talked about for the first part was what happens, to the children in your programs while you have them. This is really about that handoff and communication between Part C, which is, the birth through 2, to you all prior to the 3rd birthday. So the A through F, these are the things that are reported to the Office of Special Education Programs at the U.S. Department of Ed. The number of children served in Part C and referred to Part B for eligibility determination. So these are all the referrals for the Part C program. B is those that were in A that were not eligible, and that determination was made by the 3rd birthday, prior to the 3rd birthday. And then C is those who are found eligible and have the IEP implemented by the 3rd birthday. And D is the number whose parents refuse consent, caused delays in the evaluation, whose refusal to consent caused delays in the evaluation or services, or whom exceptions applied. So there's it wasn't our fault that we didn't have a decision made and an IEP in place by 3rd birthday, if that was the case. And then E, the children determined eligible under Part C less than 90 days before their 3rd birthday. So it's possible that a child could be found eligible for Part C, with less than 3 months to go before they'd become the responsibility of you all under Part B's preschool program. And then F is the number whose parents chose to continue early intervention services beyond their child's 3rd birthday through a state policy. So there's an option that states have to opt into, and I don't know if Kentucky is one of those states or not. There's not many that allow for Part C services to continue until the child enters kindergarten. So there are some states that do that. I don't think Kentucky does.
Hi, Steve. This is Andrea. Kentucky does not do that.
Yeah. So you guys can ignore F because that would be a 0 for you all. So let's go to the next slide, please. So really, this is a compliance indicator. This is one that the state is required to report on their rate of compliance, and the goal is 100%. Would be, referred, found eligible, have an IEP by the 3rd birthday. And if not, the information must be provided about timely correction of noncompliance. So the state has to implement ways to collect that. So really it's C divided by A minus B minus D minus E minus F. So really it's A is all those children that were referred, and then all the other like options of like they weren't eligible and we decided that by their 3rd birthday they were not, there were parent refusals or there was delays in evaluation or exceptions, or they were referred and eligible, with less than 90 days to go. So all of those things. So really that's really just looking at, are your processes in place to, have that communication between the state lead agency for Part C and, the providers at Part C level to you all, and whether you have processes in place to get those evaluations completed. Because, there's not a lot of time, when a child turns 3 until they enter kindergarten, there's not a lot of time. And so this is an important thing to make sure that, those children have as much time as possible in your programs, so that they can make that progress we've just been talking about. Let's go to the next slide. And now, I was really quick on my part. We're going to turn it back over to Andrea, and she's going to talk to you about how things around early childhood transition work in Kentucky.
All right. So again, this is our SVP support guide. Please check that out for information about indicator 12, as well as all of the other indicators that touch your work. Next slide. All right, so as Steve was saying, the Part C to Part B transition is incredibly important. It is something that a lot of families have a lot of apprehension about. So, I mean, if you have your own children, if you have grandchildren, nieces, nephews, kids in your program that you're close to, think about those situations where you're having to put yourself out there with them. You're having to take that child to a place that maybe you don't know. Again, the parents may have had a poor experience in public school. And so they've gone through this program that's been in their home. It's been very family oriented, family centered. They can be with their child in Part C during all of these services. And now they're taking their child to school, which can be very intimidating for some of our families. So we always say that you have to remember that you're not just transitioning that child, but you're transitioning that family as well. We really want it to be as seamless and as easy as possible for everyone involved. We know that Part C programs in Kentucky, we call it the Kentucky Early Intervention System, KEYS. That was formerly known as First Steps. We're all trying to struggle saying KEYS instead of First Steps because it's just happened and it's difficult for all of us. But when those KEYS staff are contract workers, so sometimes they come and go. Sometimes they're there one week and they're not there the next week. So it's really important for Part B programs, for preschool programs, to have those good connections with their Part C, with their KEYS providers, with their local points of entry, really having those relationships, building those relationships so that when that KEYS service provider decides to not to do this anymore, you have that relationship where they'll say, hey, I'm leaving, but here's my caseload. Next slide. So these are the steps that we've got for preschool transition. We've got the transition conference, which is scheduled by Part C. That is something that you, as a Part B representative, a preschool representative, you have to be invited to that meeting. This is a place where communication is really important. We have some programs that have like a monthly meeting with their Part C partner, and they've got that really great relationship, so they know these things are coming. We have other places where maybe they only transition 2 or 3 kids a school year, so they may get that phone call on Friday and say, "Hey, this meeting's on Monday, and I need you to show up," or even the same day. It's really important that you attend these transition conferences, because this is where the conversations happen about what comes next for that child and family. That what comes next could be state funded preschool, it could be a Head Start program. The parent could say no thank you to all of that. That's where all of these kind of heavy conversations start. Once you get through that, you have the referral, you have your ARC meeting, you go through all your evaluation, eligibility, IEP development process, and then you put the least restricted environment. That's where the child will receive their services. Again, that could be in a state funded preschool program, a Head Start program. Then you kind of go through that implementation and progress monitoring. So everything by step 7 has to be done by the child's 3rd birthday. The 3rd birthday is the deadline. There are some caveats to some of this, but that is very specific to that child and that situation. But the 3rd birthday is a hard deadline for preschool transition. Next slide, please. Okay, I think I'm turning this over to Carol Ann now. All right, cool.
I think so.
Thank you.
Thanks, Andrea. Thank you all. It's good to see you all this afternoon. Glad to be here. And I'm going to share just a little bit of additional information regarding indicator 12. If we go to the next slide, Steve and Andrea have already shared with you what we are measuring with indicator 12, but it's on the screen there for you again. This is a compliance indicator for our state performance plan annual performance report. So we are required to monitor this indicator and ensure compliance with the districts throughout the state. Next slide. This is the federal regulation that we look at when we're looking at indicator 12 to ensure compliance and that we have that IEP implemented by the student's 3rd birthday. Next slide. And this is a screenshot from the compliance record review document. If you're not familiar with that document, I would really encourage you to take a look at it. There's a QR code at the end of my slides today that will have a code where you can access that. It's available on our website. And it is the document that we use at the state level to monitor for compliance with student special education records. And then it's also available to you to use in your local school district to monitor those records. You can use it for self-assessment, for teachers to monitor their own records, or you can randomly pull records and do your own record reviews to see how you're doing with compliance in your district. So it's just a tool that's available to you that could be very useful. And there's one specific item in the record review for indicator 12, and that's what you see on the screen here. It's just a screenshot from that compliance record review document, where we're looking to see if that IEP has been put in place by the student's 3rd birthday if they're transferring to us from KEYS program. Next slide. And so before I get into the information on this slide, I just wanted to share with you how we monitor this indicator, because I did share that it's a compliance indicator. So we have to monitor to ensure that districts are in compliance with the requirements of the indicator. And we do that for indicator 12 through a self-assessment. We will send out to you sometime in May, we will send you a survey that asks questions regarding your indicator 12 data, and we will ask you to report to us your data specific to this indicator. We take that self-reported data and we check it, we verify it, we look through it to see if there's anything that kind of stands out that we need to follow up about. If you tell us that you have non-compliance, we make sure that that seems reasonable and that, there's nothing standing out there. And as long as it does, we accept your determination of non-compliance and we'll notify you about that in the next steps. If you report 100% compliance with the indicator, we randomly select 10% of those districts to do a desk audit here at our level, just to check and verify that that information is accurate. And we'll let you know if you're one of those districts that's chosen for that random desk review. We'll send out a letter to you so you know before we do that. And then after the review, we'll send you a report so that you'll know about your results. And so the data that you see on the screen is the most recent monitoring data that we have that we will actually be submitting in our state performance plan annual performance report that's due by February 3rd. So we're getting ready to submit this information to US Ed. And there were 5 districts that self-reported non-compliance. And out of those 5 districts, it was a total of 8 students. And some of the reasons for the delay in getting the IEP in place for the students were related to lack of communication between the KEYS program and the receiving LEA or school district. And then other reasons that were provided to us were new doses that didn't understand the preschool timelines. And so those were some of the reasons for that non-compliance that was self-reported. We also reviewed 14 districts that self-reported 100%. And through that review, all of those were found to indeed be at 100% compliance rate. So though there was no non-compliance found during the reviews that we conducted there. But this, I share this information with you because I want you to be aware. I want you to know that it's coming. I want you to have a chance to look through your files, see how you stand as a district. I will say, if you've missed a timeline, you know, that's not something that you can go backwards and fix if you missed the date. But you can go ahead and put some correction in place. For example, if you missed the timeline, you still want to make sure that you're making the steps towards getting that IEP in place and implemented if appropriate. If you find that you were delayed in the implementation of that IEP for some certain reason, you may need to come back together as an ARC to consider the time missed. And do you have any time that you need to make up for that student if that IEP had been in place on time? So there's things that you can do to go ahead and kind of correct the situation so that when you report it to us, if you do have to report that you are over the timeline, you can also share with us if you've already corrected that, and then there won't be as much that you have to do on the back end. So I did want to share that information with you. And the next slide just it includes those QR codes that I talked about. The first one is for that compliance record review document. And then the second one is for the IEP guidance document, in case that may be helpful to you. And I think I'm the last one in our group that is discussing indicator 12. So does anybody have any questions for any of us that are specific to this indicator? All right, if not, I think we can move on to the next slide, and I'll turn it over to whoever's next.
All right, thank you, Carol Ann. That'd be me again. So we've talked about the littlest ones that you all are charged with serving and have responsibility for, and now we're gonna like zoom past all of the other transitions. You know, the transition to kindergarten, the transition from elementary to middle to high, and we're gonna jump straight to indicator 13. Secondary transition. And not that those transitions aren't important, but I think in the terms of in the eyes of the federal government, there's only so many things that they can ask of you all to track and report on. And so they've looked at instead of those transitions between different school levels, they're looking at the tail end of the student's experience and the transition from high school to post-high. So indicator 13 is all about secondary transition, and it's the percent of youth age 16 and above with an IEP that includes all those words. And that's a lot of words. So I think I've broken it out on the next slide to give a bullet list of those required elements. And the first required element is it has to be an appropriate, measurable post-secondary goal. It has to be updated annually. It has to be based on an age-appropriate transition assessment. The transition services must be aligned with the student's ILP. And then this little sub-bullet here about 8th grade year when the students reach age 14. Carol Ann, I think, is going to talk about that in the next piece. I missed this part of the slide to take that out, but she's going to talk about additional requirements in Kentucky. The courses of study that need to be aligned, the annual IEP goals related to the student's transition services needs. The student needs to be invited to the meeting, and there needs to be agency participation with the parent or adult student's consent if that's appropriate. So those are the items that need to be present in order for the standard to be met. And this, just like the indicator 12 we talked about, this is also a compliance indicator and needs to be 100%. So if you have an IEP that has 90% of those bullets but doesn't have that last one, that's non-compliant. So it's a lot, but all of those pieces are very important to students transition and being able to move on and be successful in life after high school. So let's go to the next. So the percent is basically the youth with IEPs age 16 and above that had all of those elements on that last slide present in their IEP divided by the total number of youth with an IEP age 16 and above. And then this last bullet here, if a state or territory's policies provide a statement that public agencies must meet these requirements at an age younger than 16, they may, but are not required to choose to include youth beginning at the younger age in data for this indicator. And so I think, go to the next slide, but I think that's yeah. And like I said, targets must be 100% and information must be provided about timely correction of noncompliance. So if there's noncompliance, it has to be corrected. And I think now I'll turn it over to Carol Ann. Go to the next slide. And she can talk to you about how that works in Kentucky.
Thanks, Steve. Yes, if you'll go to the next slide, we will go ahead and talk about indicator 13 in Kentucky. Again, this slide just shares with you what we are measuring. If you'll go to the next slide, I think we start with the Kentucky specific regulations that we take a look at when we are monitoring for indicator 13 and we're reviewing this. Just like indicator 12, this is a compliance indicator, so we do have to monitor to ensure that districts are meeting the compliance requirements under the indicator. And as Steve said, this indicator looks at students who are 16 and older, and we do the same in Kentucky. When we review student records, we're looking for students age 16 and older. But in Kentucky, as you probably know, we do have some requirements for transition starting at age 14. So we look to make sure that those were in place for those students by their 14th birthday. And then we look also at all those requirements that have to be in place by age 16. So this slide, I'm not going to read the regulations to you, but I wanted you to be able to see them and know that they were know what the regulations are that we're monitoring. So the next slide continues with regulations, I believe. We can go to that. These are more of the regulations. All of these are found in 707 KAR 1320. And the next slide. All right. Again, I wanted to mention the compliance record review document. There's a link here. There's also the QR code that I've provided for you. And I think someone dropped the link in the chat as well. There's a section in that document related specifically to transition. What differs with indicator 13 a little bit from 12 is indicator 12 is one regulation we're looking for. It's like one requirement. You have to get that IEP in place by the child's 3rd birthday. Indicator 13 has a lot of requirements that have to be in place in order to be compliant under this indicator for a student. So all of those are outlined in that compliance record review document. And then next slide, I think I actually have a list for you here of the required components. So these are the items as they're numbered in the record review document, and then just a brief description of what each of those items are measuring or looking at for indicator 13. So these are the different components that we are looking at. Next slide. All right. So the details I wanted to get into today and share with you are around some of the common citations we see of noncompliance when reviewing files for indicator 13. We received a lot of self-reported noncompliance this year, as well as noncompliance that we found when we reviewed records. Monitoring for this indicator is very similar to indicator 12. We do ask you to provide us with self-reported data. We will send a spreadsheet out to you sometime in May where we'll ask you to randomly select some of your student special education files and go through those with the compliance record review document and determine if you are compliant or not compliant with each of those regulations. And then you'll provide that data to us. We'll review it to make sure it looks accurate, and we'll let you know next steps. And then we also review 10% of those districts that say they're 100% compliant with the indicator to ensure that they are indeed compliant with indicator 13. And so on this slide, you will see the regulations that were found to have noncompliance the most. Don't worry about sitting here trying to figure out what they are. The next slides, I'm going to go through each of those and explain them to you and kind of talk about things to think about or some of the common mistakes that we see so that those are things that you can work to avoid. Next slide, please. All right, one of the most cited areas of noncompliance is the regulation that you see on the screen. And so in thinking about this one, there's just some important questions to ask when creating an IEP to help make sure that all of these components are included. And so some of those questions to kind of think through: is the goal measurable? Does it include education, training, and a specific job? Does the IEP include transition services that are needed to assist the child in reaching their goal? And does the IEP include specific courses to assist the student in reaching their goal? One of the things that we see as a common mistake in the course of study is that it doesn't include the specific courses. Sometimes we'll see electives written for 2 or 3 classes for that student. And electives doesn't tell us what exactly the student's going to be working on. It's fine to have electives in there, but we need to know the specific names of those. They may change over time too. The student may change interest for the next school year, and you may need to update those elective courses and change them. That's okay, but it needs to give the specific course that you anticipate the student taking rather than just stating electives. So that's kind of a common error that we see to watch out for. Right, next slide. This is another regulation where we see noncompliance quite often when we're looking at the ARC meeting notice, when we're preparing for a meeting discussing transition. And some of the most common mistakes that we see is not marking the purpose of the meeting, so not including that the purpose is to discuss transition. And then we also see errors in the invitation regarding an outside agency. So either not marking that an agency would attend or identifying the agency, or not marking NA on the meeting notice if it's not applicable at that time. And so those are just some of the common mistakes that we see that we want to point out to you so that you can avoid those. Next slide. All right. And this one is about ARC membership and the child being, or the student being invited to the ARC meeting. And so some questions to ask yourself for this is, was the child invited? That's a requirement. And if the child was invited but didn't attend the meeting, were there other steps made to ensure that the student's preferences were considered during that meeting? And then how are you going to document that in the conference summary? That's what, when we're monitoring, we're looking to see, was the student invited? If the student was invited, but there's no record that they were at the meeting, we're looking in that conference summary to see if there's some type of documentation that the student's preferences were considered when developing those transition supports. The next slide. for this area of noncompliance, we're looking really at that outside public agency that's invited to the meeting. And so some questions to kind of consider here to avoid issues. Is a public agency paying for transition services? Is it appropriate to invite them to the ARC? Was consent obtained from the parent prior to inviting the outside agency? And this is one that I'll mention when we do our record reviews, we notify you of that. And we tell you that we will access all of the documentation we can from Infinite Campus. But if there's anything that's not available there, we ask you to upload it to us through a secure file server, and we can give you directions on how to do that. This is one of those that sometimes is missed because a lot of times the consent to invite the outside agency, some districts don't keep that in Infinite Campus. Some keep that at the district in the file. And so if it's not in Infinite Campus, it's something that you will want to make sure to upload for us to be able to review so that we will have that documentation. Another piece on this one is if the outside agency was invited and couldn't attend the meeting for some reason, it's important to think through how will you take other steps to obtain participation from that agency in the planning of services, because that's required. If you look at the regulation, if you look at that last bullet there, it says if the representative of the public agency does not attend, the LEA shall take other steps to obtain the participation of the other agency in the planning of any transition services. And you can document that in the conference summary on how you did that. But that's a piece that we often see. We see a common kind of myth or misconception with districts that think, I invited them, they didn't show up, so I've done my part. Well, it goes a little further. If they don't show up, there's still requirements for you to obtain their participation. So I wanted to make sure to point that one out to you as well. All right, in the last slide, just QR codes for you again with some documents that may be helpful to you. I know I just shared a lot of information, and I'm happy to take questions if you have them. And also just wanted to share that you have these tools to help support you. Go ahead and start looking at, I would encourage you to go ahead and start looking at your records. If you see things that are non-compliant, schedule ARC meetings, correct those things. You can correct those now before you have to work on your self-reported data to send to us. And you can already have your files in great shape and compliant if you start looking at them now and making corrections as you see them. Whenever we monitor, we look at the most up-to-date documents that are in there. So if you find something that's incorrect in the IEP, you have an ARC and you get that corrected, we're going to look at that most recent IEP that has those corrected components in it. So I would encourage you to take a look at that. And if you have any questions or need help as you go through that process, feel free to reach out to our team. We're happy to help you. So I'll take any questions if you have them.
Thank you, Carol Ann. I
You're
think
welcome.
y'all hang in there. We have one more indicator. As you can see from this is why we want to get this information to you in January so that you can start looking at your records, holding ARCs if you need to make any corrections, so that your reporting this spring and summer goes well. And then, so Steve, we will kick it back to you for indicator 14.
All right, thank you. Let's go to the next slide. So now we are coming to the culmination, not just of this presentation, of this webinar, but of the outcomes that we're hoping to achieve with, with the students with disabilities in your care. So this is all about post-school outcomes. This is not a compliance indicator. This is a indicator where the state sets targets, that are hopefully achievable, but ambitious as well, for the percentage of youth no longer in secondary school that had IEPs in effect at the time they left school. So not just graduated, but just left for whatever reason, dropped out, graduated with a regular diploma, had reached their maximum age, received an alternate diploma, received a certificate, however those students exited when they had an IEP in effect when they exited, how many after 1 year were enrolled in higher ed or competitively employed, which is specifically defined, or enrolled in higher ed, some post-secondary education or training program, or competitively employed or some other employment within 1 year of leaving high school. So A is included in B, and B is included in C. So these are not mutually exclusive. And it's not really a hierarchy. I mean, A is higher ed, B is higher ed or competitively employed. When it comes to outcomes for children with disabilities, if they're in higher ed or if they're competitively employed, those are both great outcomes that we're shooting for. So it's not that A is better than B. It's just the way that they were written and decided upon like 20 years ago when these first came into effect. So that's what we're looking for. We're looking for the percentage that are in higher ed, competitively employed, or some other training or employment. Let's go to the next slide. For the time, we're not going to really get into this. I'm not going to read these for you, but this is just the language of how it's calculated for A, B, and the next slide is C. Since you'll have access to these, you can take a look at those at your leisure. The next slide. States need to define, or states need to describe the metric they use to determine how representative their data are. So states, can sample, they can choose certain districts, every other year, half the districts. There's lots of ways states can do this, but they have to talk about how they make sure that their state level results are representative. And information must be included about the extent to which the response data represents the demographics of youth who are no longer in secondary school. So it's not just did we pick kids, or students who are no longer in secondary school that are representative of the state, but then also of the ones that responded, are they also representative? And it should consider things like race and ethnicity, the disability category, the geographic location. Could be other things too. So those are the things that the state needs to consider when they're looking at the outcomes and reporting on the data. And I think that was my last slide. And I'll turn it over now to Jason, and he will take you through how post-school outcomes work in Kentucky.
All right. Thank you very much, Steve. And thank you all for your time this afternoon. I think we can both blame and thank my former colleague, Alicia Reeves, for all of the content that we have for today. And it was actually, I think, Alicia's genius that said, we need to be talking about transition and indicator 13 and 14 now, as opposed to waiting closer to the end of the year. And as Alicia was a former director of special education, she was able to really reflect on and advocate for that, thinking about transition and the leadership that it requires to really improve post-school outcomes for students with disabilities. That's a year-long process. That happens 12 months out of the year. We're very fortunate at OSEEL and across the field in Kentucky to have Dr. Marisa Duarte with us today. Like you all are, Marisa was very recently serving a Kentucky school district in the capacity of Director of Special Education. And so we were excited to recruit and attract Marisa to the State Department within OSEEL. We quickly recognized Marisa and Dr. Duarte as a leader in the field through some great work that she was doing locally as a director. So Marisa had a local transition team in place. She was had intentional collaboration with career and technical education professionals, counselors, a variety of administrators locally, as well as gen ed and special education teachers as well, who were all coming together to talk about how are our students doing in terms of their post-school outcomes. Marisa led an initiative locally to really triangulate and analyze data that included indicator 14 data to develop action plans that would move students forward in their transition to post-school environments. And so Without further ado, I will turn it over to Dr. Marisa Duarte to talk more about indicator 14 and even more specifically, how to lead to enhance student outcomes.
Well, thank you very much for that introduction. Good afternoon, everyone. I am so excited to be present with you this afternoon. You can go ahead and advance to the next slide. So I just want to circle back around to a little bit of information. I know Steve has already gone over this information, but I want to give a little context to indicator 14. And so the subcategory A, when you're thinking about the percentage of students in high school or that left high school that are now in higher education, they're either enrolled part-time or they're enrolled full-time, and they have completed at least one semester of school since they left high school. And they could be at a four-year college or a community college. And so we want to make sure that this also includes the students with intellectual disabilities or developmental delays who've gone on to a program that may also be at the higher education level. And then there's 14B, which includes the higher education and competitively employment. So I want to give a little context about competitively employed youth. And so these are youth that are employed with non-disabled peers and are making above minimum wage and working at least 20 hours per week for like 90 days on average. And so this is for the previous year, and it also includes their military service. So if you have a student that leaves school and goes to the military, chooses that as their employment, that this is the category, subcategory B is where they would also fall. And lastly, is 14C. And so these youth are the ones who they may be entrepreneurs, or they also may be employed by their family business. They could be in Job Corps, they could be at the Carl D. Perkins Center, and a variety of other different locations such as that. So I just wanted to give you a little context around A, B, and C. Next slide, please. And so with indicator 14, this is particular data that is collected specifically for you, but for us as well. And so these are questions on the slide that would actually help you to make your program better or to actually adjust your transition program. And so I want you to consider these questions when you're actually reviewing how you are doing transition, collecting the data and making improvements to your program for indicator 14. Next slide, please. So this is the taxonomy for transition programming 2.0, and you may or may not have seen this before, but this is actually the research that came about that the predictors of post-school success were derived from. So we have 23 of those predictors. And so you'll hear us talking about the predictors of post-school success, and that is something that I actually utilize within my district when developing my team. And so the taxonomy it has, as you see on the screen, there's 5 primary practice categories. So there's student-focused planning, there's student development, interagency collaboration, there's family engagement, and program structure. So these are things to consider when you're planning your transition program. You want to think about how are you incorporating this information and making it better for your program. And so this is a comprehensive approach that ensures that all of your students are successfully transitioning and receiving the support that they need while they're in school. And so we want to make sure that they, again, are prepared for employment, higher education, and all the opportunities within their community. Next slide, please.
So I have here some strategies that you can take on and pass on to your teachers, your educators. And so some of the things that you can do is make sure that they have an accurate understanding of the data and that they can identify ways to improve the post-secondary options for students. And so when they're actually reviewing the data, you want to make sure that they understand the areas, excuse me, of strength and those of needs. And so that is part of them being the collaborative transition team. And so you want to, again, I'll say this, review the predictors of post-school success. They are actually evidence-based, research-based, and promising. Next slide. And so on this slide, there are actual strategies for you as an administrator. And so as the lead of the team, you want to also ensure that you are familiar with the strengths and the needs. And this will help shape what you do next. And so if you look at the data, you can reflect on the supports that you need to provide for your educators. And so this will increase, you can do this by increasing student participation rate with the surveys in your district. You can make sure that you have a commitment to ensure that your students with disabilities are college and career ready. And you may need to reach out to us here at KDE or to your CERTEC for assistance. However, it's very important that you, as the administrator, can support your teachers in the area of needs. So finding out what those are and then maybe doing some research, asking for assistance if you are unfamiliar on what needs to come next. Next slide. And so strategies for increasing your response rate. Sometimes students leave school and we don't have any idea where they are or how to get a hold of them. So as a director of special ed, one of the things that really worked for me was having teachers who were connected to those students. Building those positive relationships is such a crucial piece of being able to contact those students once they leave school. Also is gathering this information about the student prior to them exiting school. Who's someone that's close to them that you can contact that may be able to know about the student, have that information, or can give you the information that you can contact the students. There's definitely more success when there's someone who knows the student and how to contact them once they leave school. And so just making sure that you have that information. You could keep that somewhere in their student file. Sometimes teachers can reach out. They can reach out on social media if that's allowed in your area. So there are various ways, but you just definitely want to make sure that that contact information is up to date. Next slide. So indicator 14, the KIPSO, is collected for us by the Human Development Institute at the University of Kentucky. And you also know this as YOYO. And so on the screen, you see the dates that it is collected. And so again, like Alicia said, having this information in January is important because you have students that will be leaving school soon, so you can start to collect the information and let them know that there's going to be a survey in a year after they graduate. We're going to be contacting you and gathering information about what you're doing. So letting them know in advance. And so this information is collected by KIPSO for us. And the website information is linked below, and I think it was dropped in the chat. And so you can go to their website to find out more about KIPSO. Next slide, please. So as a director of special ed, it's important that you have an account. So if you do not have an account, there's information here on how you can go about creating your account. And so within this dashboard, you will find the information specific to your district only. You'll see years of the data, and
you'll be able to review it. And so with this, you'll also be able to, if you're not the person collecting the information, you can assign that to your designee. And this is also where you will do that information, provide that information as well. And another thing that you will also do in the on this website is you will take a test. So you have to take a test and pass this quiz in order to be certified, in order to administer the survey, along with the folks that you designate. They too will take the quiz to be certified. And all this information, you'll be able to see the status of your designees, whether or not they have taken the quiz and passed it. And so that information is also, again, on their website. And there is a video to walk you through how to set up your address or your account if you do not have one. Next slide. So this information is the most recent from the 24 yo-yo data, and it's also on the KIPSO website. And I just put it here as a visual for you to see what it looks like. And this is the raw data, which is the data that is before we actually know the results or the outcomes for A, B, and C. And so this is just what you will see, some additional information. And this information is also public. This portion of it is public. And so parents can go there, or anyone who's interested in the information can go and see the data. Next slide, please. This is the fun stuff. So this is a great opportunity that is going on within the transition education unit. And so we have here, excuse me, the Kentucky Transition 360. And so this is where we are partnering with local, state, and regional folks in order to have family mentors that's going to be able to collaborate with agencies and connect parents and students with educational partners. And so we wanted to make sure that you are aware of what's going on and how this is working. And so we'll have family mentors across the state providing one-on-one services. They'll also provide group services to support the families and helping them to understand the tools and resources available to their student when they transition. And so next slide. And then here is also a professional development opportunity. The Transition Education Unit has or in the final stages, I should say, of completing the Kentucky Transition 360 for Educators rollout. And so it's open to any public school educator, and it could be a general ed teacher, your CTE teachers, your special ed teachers, your paraprofessionals, and you as an administrator can also apply. And so the QR code and the link takes you to the application for this professional development opportunity. And so we do hope to be, or we do plan to launch this in January. We are in January, so we only have a few days left. So it is online modules with lessons covering a variety of transition and post-secondary topics to help inform and educate persons or educators on transition. And at the time of this development, we had over 500 applicants. I can say that we have increased that to over 600 applicants. And we wanted to let you know that this is a rolling cohort of educators, and we are excited for the outcome and the opportunity to share this information with you all. Do you have any questions about indicator 14 at this time?
Thank you so much. I think we may have overwhelmed them just a little bit. So everybody take a deep breath. And Frank is going to close us out with a leadership moment. But while we're transitioning to Frank, take a minute. You've had early childhood indicators and post-secondary transition indicators. Take just a minute and write down a couple of your next steps so that you can work toward better outcomes for your students and toward compliance. What are some things you can do within the next week that you heard about today, or what is something you can follow up on? And then Frank, we'll turn it over to you.
Thanks, Alicia. All right, so everyone, it has been a great webinar today. There's been so much information provided, and we're thankful that you've been here with us today. Just we like to end these workshops with just a little leadership takeaway, something to think about, something to put in your toolbox. So today it's just some real simple, straightforward tips. Just remember to focus on communicating effectively, listen and understand your team's issues, listen to your parents, and give good feedback to people. Be responsive to your team when they have questions for you. Be empathetic. Try and understand others' viewpoints and the things that they're dealing with, and try and look at situations that are coming up from someone else's point of view. Lead by example. This is something that we all should be thinking about, but this is something that sometimes slips away from us. So behave in the way you want your employees to behave, right? Be pleasant, be kind, be thoughtful. Listen, as we talked about just a second ago, listen to people and take input. Have a clear vision for what where your district is going in terms of special education. Share your vision, develop your vision with your team, and adapt to the strengths and weaknesses that folks have, and help them see how they can contribute to moving your students in the direction that you're trying to move them educationally. Seek feedback, constructive feedback. Listen to what people are saying. Ask people for input on how you're doing. Part of your job will always be to evaluate your staff, but give them the opportunity to also provide feedback to you and listen and make changes, as necessary to create or maintain a good culture of learning and improvement in all of your staff and in all of your schools. Be yourself, right? Don't try and be somebody that you're not. Be straightforward with people, and when there are things that you need to work on, which we all have, take the time to work on those things and to learn and grow in your role. And then the last one here is encourage creativity. There are so many things that happen in special education every day that present new challenges. And so it is important not only for you to be able to think broadly in terms of strategies that you might use, but also to encourage your staff to think broadly and try and avoid falling into that we've always done it this way kind of a situation. That really doesn't bode well for your school or for your students. It's important to always be thinking about a different direction, something else that might work, and just be broad in your thinking and be creative. That's it for me. Alicia, I'm going to give it back to you. Again, thank you, everyone. We appreciate you being here and getting to spend the time with you.
Yes, thank you. And Lindsay, if you could go to the next slide. We do have a survey, just kind of, and I promise we read through these results from your survey. So ideas that you have, thoughts that you have. I know we pack a lot of information into 2 hours, but that's because there's a lot of information that we want to expose you to. Remember, we don't have to know everything today, but we just need to know what we need to be looking for and what questions we need to be asking. So thank you all so much. We will be back the third Thursday in February to see you all again then for our next session. So I hope everybody has a great afternoon. Everybody stays warm and that just have a great week.